Senator Joe Lieberman, the real independent from Connecticut, says he will join a Republican filibuster against the Senate Democrats' health care reform bill unless the government option is removed. Other Republicans are demanding transparency from Democrats.
We don't have time to read bills because major pieces of legislation are behind closed doors are changed with no regard to the will of congressional committees.
There's only one purpose for a 1,000-page bill, and that's to hide stuff.
And one thing you won't find anywhere in that bill is the political reality that it would be political suicide for any state hoping for federal funds to actually opt out of the government-run program. Senator Johnny Isakson, Republican from Georgia, joins us now for Happy Hour. Sir, thank you for joining us at Happy Hour. Go ahead. What about it? You have Joe Lieberman now siding with the Republicans. Olympia Snowe, I guess she's agreed to vote against it with the government. Is the government option going to be removed from the Senate bill or whatever becomes the new bill after the machinations that go on?
Well, already 7 Democrats have made qualifying statements that leave it open that they might not vote for it. Senator Snow's not going to vote for it. And just as you pointed out, we already have a historical reference on an optional government option, and that's called Medicaid. Not a single state in the country opted out of Medicaid. They're going to not opt out of a public plan, and the public doesn't want it.
Public doesn't want it, sir, but it seems like they continue to push this thing forward. Now we have potentially the option to opt out of the public option, which makes the whole thing that much more convoluted. People are really concerned. They're very confused, and every day it seems to just get more and more confusing. So what do you tell your constituents at this point?
Well, I tell them, as a member of the Health Committee, I've read the only bill that came through the Health Committee, but the bill we're going to be talking about is being written behind closed doors on the second floor of the Capitol. I don't know, so certainly they don't know. We're just going to have to wait and see what Harry, Reid, and the committee want us to see.
Well, and that's just it, though. I mean, is there any one litmus test in the bill that you're looking for? The public option, we don't even understand what that means. As you underscored, Medicaid, Medicare, we've already got some public options out there. It's all very confusing to everyone. That's what I think people want. Can you give us a little clarity? What's the litmus test? What's the most important element that you're looking for?
Well, most importantly is not to destroy the coverage that 86% of the American people have, either through Medicare, Medicaid, or S-CHIP, ERISA plans, group medical plans, or state-regulated plans. We need to try and fix the 14% that don't have access, use buying insurance across state lines, forming risk pools across state lines, making sure that Medicare and Medicaid people who are eligible and aren't enrolled are enrolled. Those are positive steps we can do step by step to ensure the uninsured without destroying the insurance for 86% of the American people.
Senator, we spend a lot of time analyzing the health care debate and the bills, the various bills on this network. Maybe the people who are watching want to know here exactly this. Okay, so the Senate bill, the final bill that goes to committee with the House bill, what the remaining bill that comes out of there, if it does not have the government option, I guess that's what the carrot is going to be to get some of these senators who've said they won't vote for it with the government option. If that's out of there, do you think a bill gets passed?
I still think it's very problematic because the pay-fors, like cutting Medicare by $500 billion, by raising the eligibility for Medicaid to 133% of poverty, those are very problematic in and of themselves. So in the end, we need to go back to square one, clean the table, and start step by step addressing things rather than to have a fundamental comprehensive change of health care all across America.
What are the odds of that's going to happen, though, sir, if you're saying it's behind closed doors and you have no control?
Well, there are 3 things going to happen in the end, I can tell you that. Number 1 is the bill's defeated on the floor. Number 2 is it's passed on the floor and then probably only through reconciliation, which is called the nuclear option. Or lastly, and most probably, about Christmas Eve, it gets pulled off the floor because they don't have the votes, and then we go back to square one.
Senator Isakson, I also got to ask you, you voted for, you fought for, you lobbied for sending something like $400 billion in TARP to the crooks on Wall Street to bail out those banks in the name of helping the people at home. But now you don't have $400 billion to fix health care. If you had to do it all over again, would you have changed your vote on the initial TARP program bailout that you voted yes, you thought was a good use of my money?
I think history will record that that vote was critical to save the financial system, not just the United States, but around the world. The subsequent use of that money I have not supported because they've deviated from the original plan. But had that not been done, more than likely there would have been a collapse and there wouldn't be any health care and there might not be any Fox.
Senator, stay on health care for a second with me. So far, all I've heard, the only Democrat, I'm sorry, the only one who may have switched his or her vote is Senator Lieberman. Do you know of others? Are you telling me that you mentioned 7? Who are you talking about?
Well, Senator Landrieu from New Orleans has made qualifying statements. Senator Nelson from Nebraska has made qualifying statements. Senator Lincoln from Arkansas has made qualifying statements. Senator Nelson from Florida has made qualifying statements. There are a lot of Democrats who've made qualifying statements, and they're saying we've got to know what it says before we vote for it, or we're not inclined to vote for a public plan. There's a lots of problem on the majority side before they even get to the debate on the full floor of the Senate.
All right, Senator, we're going to have to leave it there. Thanks a lot for joining us at Happy Hour.
Thank you very much.
All right, on tap, the beautiful, super smart Andrea Tantaros tells us